Hi, my name is Deborah Logan, and this is my RN to my LPN to RN transitional Foley catheterization video. It is March 22nd, 2025. Prior to coming to patient's room, I did verify that patient does have an order to insert a Foley catheter today. Knock, knock. Good morning. My name is Deborah, and I'm going to be your nurse for today. May I verify your name, please? May I see your armband? Could you tell me your name as well? Valerie Johnson, December 1st, 1962. Okay. Ms. Johnson, your doctor has written an order for Foley catheter insertion today, and I'm going to be doing that. Now, the process entail a thin, long catheter that I will be inserting in your urethra, which is going to be going into your bladder to help drain some of that urine that's in there. Now, before we proceed, do you have any allergies to iodine or latex? Patient has confirmed that she does not have any allergies to latex or any allergies to iodine. I am now going to perform hand hygiene and put my gloves on. I'm closing the curtain for privacy, and I'm raising the bed to working level. At this time, I am going to be asking the patient to position herself in a dorsal recumbent position. She has no physical limitation that will prohibit her from being in this position. I am going to lift up her blanket and her gown, exposing her vaginal area. I have a box of perineal wipes right here. So with my non-dominant hands, I am going to open her vagina, exposing her meatus. I'm going to use one wipe and one stroke go down the left side from the meatus to the rectum. I'm going to dispose of that. Another one on the right side, meatus to rectum. We're also going to dispose of that, and another one in the middle to the rectum. I'm going to also dispose of that. I am going to then dispose of my glove. I'm going to perform hand hygiene. I'm going to grab my Foley catheterization kit, which I have here just for time and space wise. This will be on another area, a flat surface, preferably a bedside table. And I will be removing my kit from that. I will be throwing this trash in that. And first, I will be opening the flap away from my body first. Then the ones to the side. One to the next side. And then one in front of me. I will be grabbing my glove. Again, for space wise, I will not be doing this on the resident's bed. I will be doing it on a flat surface away from the bed. I am going to now open up my glove. I am going to be using my dominant hand to grab the inner fold of the glove and place it on my non-dominant hand. On, and then I'm going to use this gloved hand and place it under the flap like this, and I'm going to be putting it on my dominant hand. At this time, I'm going to be throwing this in the trash. Then I'm going to be removing my drape, opening it up on the outside next to my patient, and I'm going to be moving my equipment also next to my patient. Okay. Next, I am going to be, if I was using this drape, this would be going over the vaginal area. So I'll be putting this over the vaginal area, but for time's sake, we will not be using this, so I'll be putting this over here. Next, I'll be removing my equipment out here. Put this to the side. So here I have my indwelling catheter. I will next be removing the syringe with the 10 cc's of water. I will be removing the tip. And I will be adhering it to the opening, which I will be using this water in here to make sure that the Foley is going to be secure in the bladder. Next, we have the lubricant. I'm going to be removing the plastic. And when I am ready, I will be lubricating the tip of the catheter and also the meatus area prior to inserting. I'm just going to be putting these to the side. Next, with my non-dominant hands, I am going to be opening up the vagina, exposing the meatus, and I'm going to be using 1 cotton swab of iodine solution, and I'm going to be cleaning the left side of the meatus down to the rectum. 1 swipe. I'm going to be disposing. Also, do it again on the opposite side, meatus all the way to rectum, dispose of that. And thirdly, I'm going to be doing the middle of the meatus all the way down to the rectum. I'm going to be disposing of that. Next, while my hand is still placed on the vaginal area, exposing the meatus, I'm going to be take my tube off. I am going to be lubricating the meatus area and also lubricating the tip of my urinary catheter. After I did that, I am going to hold the catheter firmly, and I am going to slowly starting to insert into the meatus area, making sure first and foremost my patient is not feeling any pain or discomfort. Ms. Johnson, if at any time you feel pain or discomfort, please let me know so I can stop. So I'm slowly inserting for the catheter. Objective is to see some urine return. And I do see some urine return in the catheter. So I'm just going to insert another 2 inches. I am going to hold the Foley catheter with my non-dominant hand. And with my dominant hand, I am going to empty all 10 cc's of sterile water into the catheter. Okay, I am going to tug on the catheter for a little resistance, which I wanted to feel. I do feel some resistance, indication that the Foley is secure. At this time, I am going to use the adhesive that's in here, and I am going to adhere the Foley to the inner thigh of my patient. I am also going to make sure that I have the label with the time and the date that I have inserted the catheter. At this time, I'm going to remove all my equipment out of the way. I am going to remove my gloves. I am going to perform hand hygiene, and then I am going to put back on another pair of gloves. I am next going to perform some perineal care for my patient, and I am going to cover her up. I'm also going to hang the Foley bag below her bladder just to make sure that it's going to be draining properly and appropriately. Make sure that it's not near any or hanging on any side rails or anything like that. I am going to put the bed back down, also into the appropriate position, into low position, head of the bed up, make sure she's comfortable, and make sure she does have her core light within place. And also, if there was an order for a specimen, I would go ahead, and this will be the time for me to get the specimen. I would label the specimen and I would take it to either the lab or in the refrigerator and notify phlebotomy that they need to come and pick up the specimen. And that concludes my Foley insertion video. Thank you.